Hello and welcome, everyone. I'm Melissa from the Massachusetts Health Connector, and I'm joined by my colleagues, Thalia from the Health Connector and Katie from MassHealth, who will be presenting today's information. Together, we are here today to share information on renewing your MassHealth coverage or obtaining coverage through the Health Connector. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been turned off. Following the presentation portion, we will have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout and do our best to address them at the end of the session. When asking your questions, please do not share any personal information or private health information, as others on the call are able to see what you write. Lastly, we are recording today's webinar, so you'll receive an email with the presentation and the recording of today's presentation. So let's get started. And presenting first would be Thalia.
Hi, everyone. Welcome again. During today's presentation, give me 1 second, not going to the next slide. Okay, here we go. Sorry about that. During today's presentation, our focus is going to be to go over the MassHealth renewal process and how members can remain covered if they have discovered that they are no longer eligible for MassHealth. During today's presentation, my colleague and I will explain the MassHealth renewal process, give information about submitting renewals, show you where you can get assistance if you need it, and how you can obtain coverage through the Health Connector. Before we go over the details, we would like to talk about the relationship between MassHealth and the Health Connector. It's important to note that although we work together very closely, we are two separate organizations, but we use one application, which means when you are applying for coverage, you do not have to specify if you are applying for MassHealth or the Health Connector. And I will pass it over to Katie to talk about the MassHealth process.
Thank you. So this just gives a little bit of overview for MassHealth. MassHealth provides health benefits and help paying for them to qualifying children, families, and seniors. Additionally, people with disabilities that are living in Massachusetts. MassHealth has about 1.5 million members, including 250,000 seniors that are individuals 65 years or older and 300,000 individuals with disabilities. MassHealth is about 67% of low-income families, 25% 1 in 4 are Mass residents, and 42% 2 in 5 children of all incomes. MassHealth covers services comparable to commercial insurance and services not covered by other insurers, like long-term services and supports and certain behavioral health services.
And for those of you who are unfamiliar with the Health Connector, we are the state's health insurance marketplace, and we offer health and dental insurance to individuals and families who aren't able to obtain coverage from somewhere else, whether that be your job or your spouse's job. And although we won't cover this in today's presentation, we also provide health insurance to small businesses with 50 or less employees. Here we have our webpage where members would go to apply for coverage. And as I've mentioned, MassHealth and the Health Connector share an application. So when you are filling out the application, you will not need to identify which you are applying for. You'll enter your personal information and the system will determine which one you are eligible, whether that be MassHealth or the Health Connector. And I also want to mention that we have the application available in Spanish as well as in Portuguese, if that is your preferred language. And I'll pass it back over to Katie, and she'll talk about MassHealth.
Thank you. So what is a MassHealth renewal? Every year, MassHealth must check if members are still eligible for their coverage, and this check is called a renewal. If you're a MassHealth member, you will need to renew your MassHealth coverage every year. When it's time for you to renew, MassHealth will try to automatically renew your coverage. If your coverage can be renewed automatically, you will not need to take any further action. MassHealth can auto-renew certain members' coverage by checking their information against state and federal data sources. If your coverage is automatically renewed, you will receive a letter in the mail letting you know. If your coverage cannot be renewed automatically, you will receive a blue envelope in the mail and you will need to respond to that blue envelope. Why are we talking about renewals now? It's really important for members to understand the renewal process so that they continue to receive the best benefit that they are eligible for. MassHealth does not want members to lose coverage because they failed to respond to a renewal. We really want members to be prepared and be ready to respond to their renewal notice. Although some rules were temporarily changed during the COVID-19 public health emergency, members need to renew their coverage every year. MassHealth uses blue envelopes to send out their renewals. If you need to complete your renewal, you will receive this blue envelope in the mail. If you receive the blue envelope, you must respond to it. If you do not respond, you may lose your MassHealth coverage. Contained in the blue envelope is important information such as your renewal date, your renewal paperwork, and other important information and instructions. Renewals occur at the household level, and notices such as the blue envelopes are sent to the head of household. After you complete your renewal paperwork and send it to MassHealth, we would like you to check your mail regularly. If you get any letters from MassHealth, please open them immediately. Sometimes MassHealth may need more information from you. If this happens, you will receive a letter in the mail in a white envelope called a request for information. If you receive a request for information, you will have 90 days to respond. If you do not respond to the request for information, you may lose your health coverage. MassHealth will send you a letter once your renewal is complete. This letter will contain what type of coverage you're eligible for. If you are no longer eligible for coverage, you'll be given at least 14 days notice before your coverage ends. You will also receive some information about how to file an appeal if you disagree with MassHealth's decision. There are a few ways that you can submit your renewal. Online is the easiest way. For members under 65 years old, you can go online to mahicks.org/individual, or there will be an individualized link provided in the notice in the blue envelope. For members that are over 65 residing in the community and members of any age receiving nursing facility care or HCBS waiver services, your notice will have an e-submission number that you can submit online via document upload or a fillable form at mhesubmission.ehs.mass.gov/ESB. We also have a few other options. You can return your renewal by mail. You can mail it to our health insurance processing center. You could also fax it to us. You can also call MassHealth customer service and we can renew your coverage over the phone. And you additionally can schedule an appointment with a MassHealth representative. We have an online scheduling tool that we recommend members use. Just to note, members have 45 calendar days to complete their renewal and send it back to MassHealth. Here are some ways where you can get help. MassHealth enrollment centers provide members with phone, virtual, or in-person assistance with their applications from MassHealth staff. We recommend that members schedule an appointment ahead of time. Appointments can be made via phone or virtual or in person at the Springfield MEC. There are 7 MECs, MassHealth enrollment centers, across the state, You can find your nearest enrollment center online at mass.gov/info details MassHealth enrollment centers. We also have certified application counselors and navigators that are community-based resources to help members apply for and renew health insurance benefits. They are trained by MassHealth but are not MassHealth staff. People who need to keep their MassHealth coverage and people who are no longer eligible for MassHealth can get help from CACs and navigators. The services from CACs and navigators are free but may require an appointment. You can go online to find their nearest organization. If you have questions about your MassHealth renewal, you can call MassHealth customer service. Hours are Monday through Friday, 8 a.m. to 5 p.m. and assistance is available in English, Spanish, Portuguese, Mandarin, Vietnamese, Arabic, and Haitian Creole. Members can also request a translator in any other language when calling customer service. When preparing for your next renewal, it's really important that MassHealth has your most updated contact information. This is so that we can reach you when it's time for you to renew. You can update your address, phone number, or email address at any time by calling MassHealth customer service. For members who are 64 or younger, you can also do this online. And for members that are 65 and older, there is also a MassHealth Report a Change form that you can find online and complete. Additionally, it's really important that you read all mail that could be from MassHealth. MassHealth will mail you information about your health benefits. You might also need to take action to complete your current coverage. Read all mail from MassHealth and look out for the blue envelope in the mail. Remember that any important message from MassHealth may also arrive in a white envelope. Just a few key points about MassHealth's information. If you are a MassHealth member, you must renew your coverage every year. When it's time to complete your renewal, you will receive a blue envelope in the mail. Check your mail regularly and open all mail that could be from MassHealth. Some important notices, such as requests for information, might be sent in a white envelope. If MassHealth needs more information from you, we ask that you always respond by the deadline. Again, it's very important to make sure that MassHealth has your updated contact information. And of course, if you need help, you can always call us. MassHealth is here to help and wants to make sure that you keep the best coverage that you qualify for. If you don't qualify for MassHealth, there are a few other options. For members under 65 years old, affordable plan options are available through the MassHealth Connector. Members can visit mahealthconnector.org or call their customer service center to learn more or enroll in a plan. Losing your MassHealth coverage is a qualifying life event which allows members to enroll in a plan through the Health Connector outside of the regular open enrollment period. For members over 65, other affordable options are available. Individuals who do not qualify for Medicare may be eligible for Connector coverage. For those eligible for Medicare, loss of MassHealth is a special enrollment period that allows individuals to enroll in Medicare outside of the standard enrollment periods. Members who lost MassHealth because they lost Social Security income due to certain conditions may be eligible to reapply. If members are no longer eligible for MassHealth, they may qualify for the Medicare Savings Plan, known as MSP, sometimes known as MassHealth Buy-in, which is a federally funded program that pays for some or all of Medicare recipients' premiums, deductibles, co-payments, and co-insurance. We do have other programs that members may qualify for, including the Frail Elder Waiver, the Program of All-Inclusive Care for the Elderly, Prescription Advantage, and other programs and services run through the Aging Service Access Points. And Talia, I will hand it back to you.
Thank you. Okay, so as Katie was saying, if you discover during the MassHealth renewal process that you are no longer eligible for MassHealth, you can always come to the Health Connector to get your coverage. Oh, so sorry. Okay, so if you're a former MassHealth member and have lost your coverage due to a recent change in employment, you might still be eligible for coverage through your job. We recommend seeing what health coverage options are available for you and your family through your employer. You want to make sure to get details about the type of health coverage that they're offering, and how much you will need to contribute out of your pocket for this coverage through your job. And also you want to make sure to ask them about their deadlines for selecting and enrolling in an employer-sponsored plan. And it's important to note that if you are offered health insurance through your job, you will not be eligible for financial help with the Health Connector. Okay, so what if the coverage offered by the employer does not seem affordable? So what you can do is visit this link on our page here, and there you will be able to fill out a form that you can give to your employer, and they will fill out information, and that can help you determine with the Health Connector if you can get help paying for your coverage with the Health Connector. Okay, so now, to qualify for enrollment with coverage, you must be in what is called a special enrollment period, and that is triggered by an individual having a qualifying life event. A qualifying life event could be losing your your MassHealth coverage, a change in household makeup, income, immigration status, or address. A qualifying life event could also be getting married, having a baby, or losing health insurance that was provided through your job. If you have any of these qualifying life events, we suggest reporting them as soon as possible because there is a time frame for when these changes should be reported. And during the special enrollment period, payment and enrollment periods are still apply. So please check your mail to make sure that you get and keep your coverage. Okay. So if you enroll in a plan with the Health Connector, it's important to note that all plans meet state and federal standards for coverage. We offer health and dental plans from the leading insurance companies in Massachusetts, and we offer subsidized coverage that could lower your monthly premiums. One of the ways you could save money on your coverage is through premium tax credits. And the other way you could save money on your coverage is through the Health Connector's Connector Care plans. This program is unique to the Health Connector and provides lower income individuals with low or no cost health insurance coverage. So as of January 1st, 2024, eligibility for the Connector Care program has been expanded for 2024 and 2025. What this means is that now more Massachusetts residents will be able to qualify for Connector Care plans that have lower premiums, lower copays, and no deductibles. So for example, with the expansion, the income limit for a individual has increased to $42,900 for 2024. And for a family of 4 to qualify for a Connector Care plan, it has been increased to $150,000. Okay, so there are a couple of tools that we have available on our website that could help you select a plan. These first 2 plans on the page, the Get an Estimate tool and the Plan Comparison tool, are available to you without entering any of your information. You can go on there, enter some very general information and see if your doctors are covered with our plans, if your medications are covered with our plans, or any procedures you may have coming up. You can use these tools and see which plan would most fit what you're looking for. Once you get into the application, your actual application, and you enter all your information, you can also use the Plan Finder tool, and that will give you a more detailed roadmap to see what you would be paying with your plan. Okay, so there are 3 ways that you can apply for healthcare coverage with the Health Connector. One of them being online, at mahealthconnector.org, We have our application available in Spanish and also in Portuguese, as I mentioned before. You can also apply by phone, or you can choose to visit one of our partner organizations in person. You can make an appointment with them and they speak the languages of their communities. And again, wanted to mention that there is one application for the Health Connector and MassHealth. So you do not have to specify which you are applying for. The system will decide which one you qualify for. And again, we also have a customer service line, just like MassHealth. They shared their information before. You can call customer service at 1-877-623-6765. And you can also visit our community partners, our navigators or CACs. There is a link on this page that you can use to find a navigator in your area and schedule an appointment with them. So just some key takeaways from our presentation today from the Health Connector. Those who have lost access to MassHealth coverage can still get health and dental insurance through the Health Connector. You should update your application to find out which plans are available to you. And we also want to make sure that you know that if you are looking to get coverage for next month, you would need to select and pay your first premium by the 23rd of this month in order to be covered for July 1st. And oh, I'm so sorry. What happened? Okay, and now we'll take any questions that you may have.
Okay, great. Thank you so much. Okay, so the first question that we have, hello, can my husband who is 66 apply for MA Health Connector separately? He receives Medicare. So unfortunately, once you enter the age of 65, you no longer qualify for the Health Connector. You would be qualified for Medicare, and they have their own separate guidelines. So what we usually do in these circumstances is refer our members to the SHINE program. They have experts who are trained with the Medicare guidelines who can help guide you through that whole process of Medicare. And I actually have that number. It is 800-243-4636 for the SHINE program. And they can definitely help with that process.
I'm sorry, I just want to add that although members that are over 65 in receiving Medicare might not be eligible for the Health Connector, we would certainly encourage them to apply for MassHealth.
Great, thank you so much. And then there's another part of the question. Let's see. Oh, sorry. Question number 2. Okay. Does being offered COBRA disqualify someone from Health Connector, MA Health, and is fibromyalgia a qualifying disability?
So I can answer the first part of that question. If you have coverage with COBRA, that technically counts as your health insurance. It doesn't disqualify you from getting Health Connector, but if your COBRA coverage ends, then you can come to the Health Connector. Melissa, I don't know if you want to add anything to that.
No, that was perfect. No.
And as for the second part of the question, qualifying disability, I'm not sure what.
I can speak to that, the disability part. When applying for MassHealth, we do ask a question, or the Health Connector, we do ask a question on the application that asks if you have a disability that is expected to last more than 12 months. When you check that off, this sends out a supplement to you that you can fill out. MassHealth partners with disability evaluation services that review this and can make a determination of disability, which may qualify you for additional MassHealth benefits.
Great, thank you. Okay. Are there income limitations to work with Health Connector?
No, there is not any income limitations to work with the Health Connector. I will say that for the Connector Care plans, there are limitations, how I mentioned in the previous slides, but people of all incomes can come to the Health Connector. Usually those who do not qualify for MassHealth would then come to the Health Connector.
Perfect. Okay, next question. Let's see. Will the Health Connector identify Connector Care plans or benefits when I go to select a plan? How can I find the Connector Care program benefits?
So there is a link to the page, and I can send it to you here in the chat, and I can also include it in the email that's sent afterwards for what Connector Care plans are available and their benefits. But the Connector Care plans would basically cover anything that any other health insurance plan would cover.
Okay, great. Okay, can you explain sources of income when it comes to investments, for example, Fidelity accounts?
So there's also a link on the Health Connector page for that, that basically outlines what is considered a source of income. So I will send that right now in the chat. Well, I will answer it live here.
Great, thank you. And then the next question, will the Health Connector identify Connector Care plans or benefits? Oh, I think, did we answer this one already? Okay, sorry about that. Okay, I have my family enrolled in a employer plan. At the same time, my son has MassHealth and we get premium assistance. My son has a disability. If I did enroll my son from the employer plan, will he lose MassHealth?
Sure. So we have the premium assistance plan, and we can't necessarily answer questions based on case specific. So I would encourage you to call MassHealth customer service to get more information on what would happen when you enroll your son in the employer sponsored plan.
Okay, great. And let me see. I think this is our last question. For the Connector Care plans, are the premiums expected to increase significantly from year to year, or is there a certain percentage it will increase?
Melissa, do you want to take this question?
Sure. The plans do increase from year to year, but also there's no straightforward answer for this question. It would also depend on your circumstances. Eligibility depends on your income, and if your income changes, your premium cost would depend on that primarily. Okay, let me see. Okay, I am a college student, 18 years old. I don't have health insurance. Can I have coverage?
So if you are being claimed, Melissa, correct me if I'm wrong, if you're being claimed on your parents' taxes, you are then considered part of their household, so you wouldn't be able to apply for Health Connector individually. Is that correct, Melissa?
Yes, I mean, so you can be considered, you can be a part of your parents' plan up until the age of 26. But let's just say if you could not be a part of your parents' plan for whatever reason, maybe they don't have insurance, and you did not have any type of insurance, you can come to the Health Connector and apply on your own. Okay, so moving along. So someone asks, is Connector Care a plan or help with the plan premium?
So Connector Care is a subsidized version of the health insurance plans. So basically we have we have regular health connector plans, and then we have the connector care plans that basically offer an amount of money to decrease the amount of premium you're paying.
Right, exactly. So when you apply, you do the application. At the end of the application, you are either eligible or not eligible. So if you are eligible, you get to choose a connector care plan. And then you also have to pay a plan premium. So the two are very different. Okay, so the next question. I have been on COBRA for the past year, but my former employer was paying my premiums. As of July, they will no longer be paying premiums. In this case, would I be eligible for a connector care plan?
I would like to say yes, because you are no longer covered with COBRA and your employer is no longer paying your premiums. You are not eligible to come and select a plan with the Health Connector.
Great, perfect. And I'm not sure of this question here. Let's see. If you can please elaborate. Someone asked, I filled my tax myself as a college student. I don't understand what that means.
I think that was in response to asking to the other question that was asked.
Oh, okay, great. All right, and let's see. Okay, what is the CAC phone number?
So we don't have a phone number for the CACs, but you can go online and visit mahealthconnector.org/enrollment assisters, and you can find information on how to contact CACs there.
And the link will also be included in the email sent afterwards. And you can click the link on the slides.
Okay, and if you want to retire from work at age 64 and you are offered insurance under COBRA until you reach Medicare age, can you elect to get insurance under the Health Connector? My employer will not be helping with the premium.
Melissa, do you want to answer this?
Sure. Okay. So you are eligible to get the Health Connector up until age 65. So if you aren't eligible for the COBRA or for whatever reason cannot afford the COBRA, you can definitely be eligible to apply for the Health Connector. And let's see, I think we answered everything. Hopefully I didn't miss anything here. Yep, I think we are all set. Oh, actually, there's one here I see here. Hi, I will lose my insurance through my husband's employer after he retires on July 15th. When should I start to apply for health insurance through MassHealth Connector? Do I need any documents from my husband's employer to prove my loss of health insurance to apply?
So for the first part of the question, I say don't wait. As soon as you know that you're going to be losing coverage, I would start the application process just to see what your options are and what's available to you. Melissa, you deal a little bit more with the documents. Do you think she should have anything prepared?
So it would depend on the application and their circumstances. Sometimes we do ask for verification, but it would depend on whether or not we needed to verify. So once they apply at the end, if they see that we need any type of documents, it would tell you at the end of the application. But another thing to keep in mind too, if you were looking for coverage for July, you would have to apply by June 23rd. That would be the deadline. So definitely apply as soon as possible. Okay, we have another question here. We have applied for Health Connector and we were accepted based on gross income. However, our income was a 50K loss and we are having challenges paying our bills. We are only eligible for a high deductible, which we will also have a hard time paying. Okay.
So in the case that your income changes, we always suggest going back into the application online or even calling customer service and updating that information because that information could change the amount you are paying monthly for your coverage.
Great, perfect. And I just wanted to add to this too. So also, we offer the advanced premium tax credit if you are eligible for that, which also helps pay towards your monthly premium cost. So just to keep that in mind as well. Let's see. Okay, and I think this might be our final question. Can you get the Connector Care plan and advanced premium tax credit?
Melissa, jump in if I say
Sure,
anything wrong.
definitely. Yep.
You,
So the way that it works is you can get a Connector Care plan. The advanced premium tax credit is just a credit towards helping you with your premium monthly cost. So the plan is separate. So you pick out a plan, but you also have the option of using your advanced premium tax credit to help pay for your monthly premium costs. So they're two different things. Let's see. Okay, on my family plan with Health Connector, do I have to remove my husband who is 66?
Melissa.
Yeah, sure. So, you would still have to have your husband on the application because it goes towards the way that it works is it's based on the household income. So your husband actually would still continue to be on the application. It's just that he would not be eligible for any plans because at that point in time, he would be eligible for Medicare and we would have him reach out to the Shine program if he needed any help with that, but he would still be a part of the whole process, yes.
There's a question here about how advanced premium tax credits are applied yearly or quarterly or other. When you're eligible for the tax credits, you can change how much are applied monthly, I believe, to each period, just because tax credits you might want to add the whole amount or less based on what you are making monthly if your income fluctuates.
Right. So the way that it works is after you finish the application, they show you your eligibility, but they also show you how much you are awarded with the advanced premium tax credit. So let's just say you get an advanced premium tax credit of $500. You have the option of using that. You don't need to use it if you don't want to use it. It's at your discretion, and you can actually put the amount if you decide, yes, I need some help, but I don't want to use the full $500 amount. You can choose exactly how much you want to put towards your monthly premium cost. It's entirely up to you. Let's see. Okay, I am having trouble submitting income verification. Every time it comes back that it isn't good enough. I have no income, but my husband does. So I can actually answer that question. So if you're having trouble with submitting income verification, usually when you go and submit, you can, usually we require for you to submit pay stubs or If you have no income, we can use a letter, self-attestation letter, just simply saying that you have no income. And you can sign that. And that should actually be sufficient. But if there's another reason, usually we do send out a letter detailing the reason why we're having trouble with the verification. So you should get some detail in the mail as to what exactly is required. So is MassHealth not allowing people who missed the deadline to reapply?
So if you miss the deadline for your renewal, we would always encourage you to apply again, or you can call customer service, and they will be able to look up your information and give you information based on your case right now. We always encourage members to call us whenever they're having trouble like this, and hopefully it would be able to be resolved over the phone.
Great, thank you, Katie. Okay, let's see. My son had an unexpected surgery last year during the time that the blue packet was mailed August through September out and received, and I missed the deadline and have been in a mess with it all. Is there any way to rectify this? This was our first time dealing with this deadline, so we just missed it, unfortunately.
This is another one I would just encourage you to give our customer service team a call. They can review your information and give you options that will be available to you.
Okay. Okay, I'm still 18, college student here. My parents' insurance doesn't cover outside of California. I filed tax myself. Which insurance should I apply?
So as I mentioned before in the presentation, we do have one application. So whether you are eligible for MassHealth or the Health Connector, you just fill out that application and then it will tell you which one you qualify for and what plans are available for you specifically in each one.
Great. Okay, and if you want to renew a connector care plan and nothing has changed with your household income, do you still need to fill out the entire application each year? And I actually could answer that question. So, you don't have to fill out the entire application. You can just go directly and say that you want to update your income. That should be enough. If there are no changes to your income, you would just simply state that there are no changes and you should be all set. So as an international student that is losing coverage through my school since I graduate, what insurance am I available to apply for?
Melissa, do you know the answer to that?
Sure, yes, definitely. So one of the factors in applying for insurance is that you need to be a Massachusetts state resident. So that is one thing that you need to do to be eligible. I'm not sure if this person's circumstances, if they are a Massachusetts resident. But if they plan to be, they are eligible to apply. I'm just not sure because they stated they're an international student, so I don't really know the full circumstances to that. So someone here writes, so I did all the income verification forms and they're still not good enough. My original deadline was February and then April, and now we are in June, and I'm still submitting and nervous about the deadlines. So I can actually answer this. So when you do the application and you are eligible, but we require documentation, usually we allow 90 days for you to submit the verification. And once that time is closed, unfortunately, it's expired and we would need to do the application process over again, and you would need to submit that information. I think I'm just looking over the questions and I don't see anything else. Unless I'm missing one. Let's see. I think we covered all these questions here. Again, if there's any question or concern, I would just say reach out to us. We're here to help you. We have a customer service number and we have assisters who are available. So if there's any type of concern or hesitation, please definitely just reach out to us. We're here to help you. We also have a language line if you need assistance with that. Our application is currently in Spanish and Portuguese, but if you need another language, we can also provide that to you and some guidance concerning that.
And for those of you who are asking questions about income and the presentation and assisters, I will include all those links as well in the follow-up email. So thank you everyone for joining us this evening and have a good night.
Thank you.
Thank you.